I take this opportunity to thank my good friend and colleague, Dr. Swati, for conducting this excellent course on minimally invasive glaucoma surgery. So in the next few minutes, I'm going to talk about a very simple but an innovative technique called bent ab interno needle goniectomy, or the BANG, B-A-N-G. So enhancing the trabecular meshwork outflow into the Schlemm's canal has been an active part, in bloodless glaucoma surgery, or in surgeries where it is kind of blood independent. And people were doing ab interno so that you don't scar the conjunctiva and you preserve the conjunctiva for future surgery. So we had trabectome for several years, and we have the implants like iStent and Hydrus implant. You saw an elegant way of using a suture or even an eye tract catheter to do a gonioscopy assisted transluminal trabeculotomy. And what I'm going to talk about to you in the next few minutes is called the BANG, which is basically how you can do in a similar way like a Cahoop dual blade. So Cahoop dual blade is basically a dual blade which makes parallel incisions in trabecular meshwork and opens up the inner wall of Schlemm's canal, and it strips the trabecular meshwork under a gonioscopy view. So this is the dual blade, and what you see is the sharp tip of the dual blade, and then you have a which easily penetrates the meshwork, and then the ramp which is there lifts and stretches the meshwork, and then the dual blade does its job. The upper and the lower half of the dual blade excise a strip of meshwork, and the foot plate kind of nicely settles on the back wall of the Schlemm's canal so that it doesn't cross the back wall, and the KDB is advanced to peel off the trabecular meshwork. And you can see how the KDB, or the dual blade, the sharp tip enters into the Schlemm's canal, the ramp lifts it, and then the foot plate is falling on the back wall of the Schlemm's canal, and then the dual blade kinds of peels off the trabecular meshwork neatly. So you can do 2 clock hours on either side. So you maybe like 3 to 4 clock hours can be done. So there has been a lot of publications now with the Cahoop dual blade, the goniotomy with the single-use blade, and we have a lot of good information on the short-term results. So usually most of these techniques are combined with the cataract surgery, and they have found that there is the significant and sustained reduction of intraocular pressure, and also reduction in the number of glaucoma medications up to 6 months and 1 year. And even they have studied with and without cataract extraction, and the outcomes have been equally good. So they found that there is a favorable safety profile, and it is an effective procedure at reducing intraocular pressure and medication burden, either as a standalone or even combined with a cataract surgery. So what is BANG basically? This is a technique which was developed by Arsham Shabani, and this is a video borrowed from him, where you can see a 25 gauge hypodermic needle is used, and it is bent at a 90 degrees at the tip. So you bend it here at the tip, and you make this BANG needle. So you can't use something which is 24 gauge. It can be very huge for the trabecular meshwork. 25 is ideal. If you use 26, it may be too small for peeling of the trabecular meshwork. So ideally, it's a 25 gauge needle, and then you bend like this. Let's see how this technique is being done in combination with the cataract surgery here. And once you have finished your cataract surgery, and after the intraocular lens is implanted, the most important thing is to do intraoperative gonioscopy. So you have to practice how to do a nice intraoperative gonioscopy. So you have to tilt the microscope towards you, and the patient eye should be tilted away from the microscope. And you can see this is the bent needle. You identify the trabecular meshwork, you insert the sharp end into the Schlemm's canal, and then you gently peel off the trabecular meshwork, which is the inner wall of the Schlemm's canal. The outer wall is kind of supporting the bent needle. And if there is any small bleed from the Schlemm's canal, you can clear that off, like how you see here with viscoelastic. So basically, you have to nicely deepen the chamber with high molecular weight viscoelastics, preferably a Helon GV. And then after washing, you can see the blood ooze, which shows that the Schlemm's canal is open and there is a ooze of blood from the canal. And then carefully watch this aqueous veins here, the collector channel and the aqueous veins. And once the chamber is pressurized, you can see this nice blanching here. That shows that the natural outflow is enhanced here. You can see those nice blanching happening, the vessel which is being shown here. So once you reform the anterior chamber and increase the pressure, you can see a nice blanching happening. So that shows the enhanced outflow through the normal channels. So this is a very simple and a very innovative technique. And I would like to again take this opportunity to thank Dr.